To the BBC News at 1. The number of people being randomly tested in the community for COVID-19 is to be increased in England from 28,000 to 150,000 a fortnight. The Office for National Statistics says the survey, taken from a random sample of the population, can give a clearer picture of the true spread of the virus. Our health correspondent Richard Galpin reports.
Right to the back of the throat, both sides by your tonsils. Might make you gag.
Volunteers carrying out coronavirus testing as part of the household infection survey run by the Office for National Statistics.
In the bag and then in the outer bag.
The survey described by the government as the most important way of finding out how the virus is spreading in the country. And now all this is to be expanded massively. From 28,000 people in households being tested every fortnight to 150,000 every fortnight by October. Households in Scotland, Wales and Northern Ireland are also to be included. All this potentially very significant.
What's going to be really important about that is getting sort of greater coverage of the country. And at the time, it will also possibly highlight early outbreaks in certain areas, but it will also give information that as we move forwards and we then know in the future that an area has an outbreak, we can look back at the data and see where people were infected.
But while this ramped up testing system should be effective in tracking the virus, there will still be gaps in coverage across the country.
The biggest challenge we've got is finding people who don't have symptoms, so don't know that they've got coronavirus, but can still pass it on, and getting tested. So the message to the public is, if in doubt, get a test.
And other serious challenges remain. This video from a thermal camera on a police helicopter show a party in full swing in Manchester last weekend, breaking the local lockdown. People here risking being infected and infecting others. Nearby Oldham has one of the highest rates of new infections in England. 225 cases were recorded in the week ending on the 14th of August, an average of 28 new cases a day. But officials are confident they can deal with it.
We've got a really robust plan in place in terms of increasing the numbers of people that are having tests, in terms of really targeted engagement with our communities that we need to increase that uptake in testing and get the messages out about how important it is to self-isolate and how important it is to quarantine if that's appropriate.
More outbreaks across the country are highly likely, and while the Office for National Statistics can track the disease, the current low rates of infection make it very difficult to spot outbreaks and any clear trends. Richard Galpin, BBC News.
Our health editor Hugh Pym is here. Will this live up to the billing?
Well, Simon, on one level it is very significant. It's like a mass opinion poll, up to 150,000 every fortnight by October, seeing who's positive and who isn't. That's really important data, and it's weighted for the population so that you get a representative sample based on age and so on. The daily cases reported by the government, that's people who presumably have symptoms and go and get tested. It doesn't reflect the population as a whole, it's just those who've gone for tests. This ONS infection survey includes people who don't have symptoms because they're in the survey, they'll be tested, they might not have even realised they had the virus. So very important, particularly coming into winter, with all the challenges that has for policymakers and just knowing how the virus is spreading or how it's receding. Now, it'll do information on a national level, UK-wide. It will include Scotland, Wales, Northern Ireland as well as England, so that'll be extremely important. On a regional level, but it won't go right down to local outbreaks. It just doesn't have the ability to do that. So Greater Manchester and Birmingham, for example, they could get down to that, but not to smaller towns. Now, it is what it is, so it doesn't necessarily give the armoury to local policymakers to work out what's going on in their areas. They've got mass testing going on, and they'll have to hope that delivers the results and information they need.
Hugh, thank you very much. The brother of the Manchester Arena bomber is facing life in jail for mass murder.